Ladies and gentlemen, once again, I'm Engineer Justin Troy C. Pagwagan, and now I'll be presenting my study entitled Satisfaction Level of Commuters in Metro Manila Traffic Scheme Adjustments and Health Protocol Implementation during COVID-19. COVID-19 pandemic has rocked the world in so many aspects. Millions infected, millions dead. In the Philippines alone, based on the Department of Health case tracker as of November 9, 2020, there were 389,000 confirmed cases, 29,000 of which were active cases. Given the high transmissibility and limited epidemiological understanding of COVID-19, governments around the world adopted different measures. The most implemented measure to delay transmission was social distancing that includes restriction to human mobility and mass gatherings, closure of work and entertainment places, cancellation and postponement of events, and community quarantine. COVID-19 has prompted governments and authorities around the globe to impose restriction on transport and mobility. But despite that, public transportation is still the predominant mode of travel. Given that public transport has been identified as a high-risk environment for transmission, it was interest to ascertain commuters and operators' compliance to guidelines for public transportation operations. According to the DOTR, since shifting to GCQ June 1 in transportation in the Philippines amidst COVID-19, there were 12.3 million commuters that have taken the train system within Metro Manila, whereas other mode of transportation were also allowed. Considering the transportation system and COVID-19, adjustments were made and health protocols were implemented. The objectives of the study is to determine and evaluate the experience and satisfaction of commuters within Metro Manila on the various traffic scheme adjustments and health protocol implementation. Another one is to provide information on what additional adjustments and changes could be done. Sampling design. For sampling design, the data gathering procedure used was survey using Google Forms. For the sample size, the target population is 200 with confidence level of 90% at 7% margin of error. Using Sloven's formula, 82 respondents were the result and 95 responses were gathered. For selection of respondents, Google Drive links were emailed and posted to office co-workers, posted on social media, and through Adamson University. For the survey instrument consists of three parts. First is the demographic. Only significant information was asked in the survey, which were the gender, age, and employment status. Next is the transportation profile, which were the modes of transportation and distance and travel time from point of origin to the destination point. Lastly, the experience section that consists of the various changes and adjustments made amidst COVID-19, which are implementation of health protocols inside terminals and transportation vehicles, the traffic scheme adjustments, the allowance to operate private transportation providers, and implementation of cashless payments. Lastly, in the experience section is the overall satisfaction level of our respondents. Data analysis. For the data analysis, results of the survey are reflected herein. Under demographic, the gender, it shows that 61 or 64.2% of the respondents were female, while 34 or 35.8% were male. For age, majority of the respondents were in the age group of 23 to 30 years old and 31 to 40. This reflects the result of the employment status where 74 or 77.9% of the respondents were employed. Next is the transportation profile. For the transportation profile, respondents answered jeepney or modern jeepney as the most frequently used transportation equipment, followed by the tricycle, then bus, taxi, MRT and LRT, van and FX, and lastly, the shuttle bus. For the travel time, it's almost equal, with greater than 1 hour and 30 minutes being the highest. Lastly, for the transportation profile is the distance, where it shows that 32.6% of our respondents travels within the distance of 3 kilometers to 10 kilometers. Moving on to the experience section, the respondents were asked to give their satisfaction level, being 1, very dissatisfied, and 5, being very satisfied. And here are the results. For the implementation of health protocols inside terminals and transportation vehicles, respondents were only satisfied with the implementation of face mask and face shield. For the traffic scheme adjustments, respondents were only satisfied with the RFID or ETC required tollways and allowance of back ride passenger on private motorcycles. For the allowing private transportation provider, our respondents were only satisfied with Grab or four-wheel provider. On implementation of cashless payments, our respondents were satisfied with the implementation of cashless payments for bus, MRT and LRT, Grab, and Angkas. Lastly, in the overall satisfaction rating, this shows that 37 or 38.9% of our respondents were neutral, while 27 or 28.4% were dissatisfied and 23 or 24.2% were satisfied. For the conclusions, on implementation of health protocols in terminals and transportation equipment, commuters of Metro Manila are satisfied with the implementation of face mask or face shield as health protocols in terminals and transportation equipment. For health protocols, namely social distancing, separation tools, avoiding talking to each other or through phone, disinfection frequency, contact tracing forms or QR codes, and temperature reading, they are neither satisfied nor dissatisfied with its implementation. On traffic scheme adjustments, commuters of Metro Manila are satisfied with the implementation of cashless payments for tollways and the allowance of back ride for private motorcycles. For the other traffic scheme adjustments, namely EDSA inner bus lane, bike lanes, and suspension of number coding, they are neither satisfied nor dissatisfied with its implementation. On allowing private transportation provider, commuters of Metro Manila are satisfied with the allowance of Grab or the four-wheel as transportation provider. For other, Angkas or Joyride, the two-wheel, they are neither satisfied nor dissatisfied with its allowance. On cashless payments, commuters of Metro Manila are satisfied with the implementation of cashless payments for bus, MRT and LRT, Grab, and Angkas. For the other modes of transportation, namely jeepney or modern jeepney and taxi, they are neither dissatisfied nor satisfied with its implementation. Overall, commuters of Metro Manila are neither dissatisfied nor satisfied with the traffic schemes adjustments and health protocol implementation during COVID-19. Recommendations for commuters within Metro Manila is first, self-discipline on implementing health protocols and self-awareness on the symptoms, the body temperature. For government sector, improve the guidelines and strict enforcement on health protocols, improve and develop engineered traffic adjustments, and a unified cashless system. That is the end of the presentation. Thank you and stay safe.